everyone. My name is Franck Renouard. I am part of the EAO task force for this Digital Days. And today I am in a cockpit in a simulator, Airbus A320. We are ready for takeoff, runway 27. And the pilot in function today is Mr. Régis Fuzier. Régis, please, could you introduce you?
Good afternoon, everybody. My name is Régis Fuzier. I obtained my commercial pilot license a few years ago, but I also work in the University Institute of Cancer in Toulouse as an anesthetist.
You are both anesthetist and pilot, professional pilot. How you can deal these two functions all together?
Well, I would say that I'm a lucky man to be able to leave my two patients. Moreover, I try to implement in the healthcare system all data I learned during my CPL training, and particularly on safety improvement based on the human factors. Oh. What a challenge.
Yes, what a challenge. So now we are ready for takeoff. We have the slot in 2 minutes. The interview we are going to perform when we will reach 30,000 feet in the sky will be around the digitalization of the medicine and the dentistry. And we will talk about not only the digitalization, but also about the limitations and threats. So see you in some minutes. Now we have to focus and to concentrate because it's time to take off.
Let's go. Okay, before takeoff checklist.
Takeoff brief.
Complete.
Flight controls.
Check.
Fly instruments.
Check. PNC, préparez-vous pour le décollage. Air France 6125, ready for takeoff. Mantoga SRS, auto thrust. Et bien on est parti.
Okay, and now we are stabilized at level 300, and we can talk because we have not to apply the cockpit steering rules. As you can see in this cockpit, we have a lot of computers helps and a lot of digital helps. That is what happened in dentistry. More and more now we have digitalization. And Régis, as a pilot, you know the digitalization now for a while. How the digitalization came in aviation?
Well, the goal of the implementation of digitalization was to help the pilots and to improve the overall safety during the procedures. Thanks to the computer, all the information needed to ensure the safety during the flight is gathered and displayed in one or two screens. Can I suggest you to have a look at panels in old aircrafts like Concorde, for example?
Yes, we had a lot of...
Exactly.
Yes.
Moreover, such techniques help the pilot during the flight with an optimization of the engine use, a decrease of the fuel consumption, helping to choose the best flight level according to the wind strength and directions, to give assistance in case of warning or caution alarm, and so on.
Okay, if I can resume, the digitalization in the cockpit help the pilot to do in a quicker way, safer way, and simpler way what they done before.
Exactly.
And also all the data are recorded, all the parameters, the voices, and it's very useful if we want to analyze retrospectively the flight and in case of problems or failure or whatever.
For sure.
Yes, okay. So we do understand that the digitalization has drastically transformed the cockpit of all the airplanes. What about the anesthesiology?
Well, it's true that digitalization has entered the theater in the last decade. In my institute, for example, we have substituted the pen by the mouth. All data coming from the patient monitoring system and the ventilator are automatically and instantly and directly recorded in the electronic patient folder. 10 years ago, we had to note blood pressure, oxygen saturation, and heart rate every 5 minutes manually in the patient folder.
So you gain a lot of time. That means you can make your crossword during the operation, no?
Well, no, I wouldn't say that. It's a fact that the system has improved the reliability of all the data recorded during the surgical procedure.
So I understand that now in anesthesiology and a little bit in surgery, but in anesthesiology, you use a lot of computer helps. And do you think that anesthesiology today is safer because you have this assistance?
Well, I would say that digitalization has improved safety in both practice, provided that the practitioners or the users know and understand the operation process and the procedures. I think it's very important.
So I understand that the digitalization helps you a lot during the operation. And is it simpler for you? Because you have a lot of machine.
Well, I wouldn't say simpler. Thanks to this technique, anesthetists can spend more time to monitor the patient and be more concentrated on the proceedings. I think it's a fact. I would say that there is a new work distribution of the different tasks.
Okay. If I understand, you gain time, but this time is not to play or to use your cell phone. It's to concentrate on other issues which are very important, and it's a transfer of cognitive resources.
Absolutely.
Okay. So I understand that in OR or in the cockpit, the computer help us to fly safer and not simpler, but at least safer. But what happened if the system failed?
Well, in commercial aviation, there is a redundancy of the different systems that allows to fix immediately a computer in case of failure. Moreover, pilots are trained to complete successfully their mission, even should many failures occur.
Okay.
It's a little bit different in a theater or operating room. In case of computer failure, we have to practice manually both the anesthetics administration and the monitoring of the patient. This increases the workload for sure.
Okay. So I understand that in case of failure in a cockpit, you have a multitude of helps, but in the operating room, it's different, and you have to return in a conventional way. Do you think that we do need a specific training for the people who use digitalization, whether in dentistry or in medicine, surgery, in anesthesiology, in the medical field in general?
Of course. I will say that in aviation and medicine, it's mandatory to understand how the information from digitalization is gathered and presented. That's why a specific training is mandatory to explain that such approach are more complex than a simple line to follow. A similar answer can be made for medicine. A training based on a computer-assisted procedures solely put at risk of difficulty if a computer failure occurs during the surgical procedure.
Okay, if I understand, the limitation of digitalization in medicine now is most of our colleagues, the young generation of colleagues, who use only the computer, in case of problem, in case of failure, can have a problem to go back to the conventional way to open stomach or to do use an implant procedure without a fantastic surgical guide. And this kind of procedures and training, I know in dentistry at least, is not discussed. Very, very rarely. And we must be very careful about this focus on the fantastic tool, could be a computer, because sometimes the computer fails. And we have to be able to go back to another, and to use another way. So, and now last question. In dentistry, for new generation of dentists, digitalization is presented as the solution to push the complication far away. It seems to be so nice. It seems that you have just to be a geek and you can treat all the patients safely. What do you think about?
Well, according to what I've said previously, I do not think that digitalization could be considered as the solution. Of course, the systems can help the practitioner in his daily practice, but the system brings a new issue. For example, what is the reliability of the system? How can I confirm the data presented by the system? And how will I have to manage the patient in case of failure, for example? In all cases, I think what's very important that in all cases, the practitioners have to maintain control over the machine.
Yeah.
At least they have to make sure that what the computer proposes matches with what they expect.
Yeah. Régis, now we are approaching Göteborg, where we are supposed to land, and now we have to prepare the procedure for landing. Please, have you some word to conclude?
Well, to conclude, I would say that digitalization has improved the safety in many procedures in the domain of aviation and medicine, provide that conception and organization and the limits of the systems are integrated during the learning and training courses. As mentioned earlier, the main objective of the system is to assist the pilot, the physician, but not to substitute him.
Yes, I think it's a fantastic conclusion.
Thank you.
It's a help. Is not. We don't give the key of the truck to the machine.
Exactly.
We have to control all the time, and to have the situation awareness means we have to be aware about the data we put in the machine and the data the machine give us back. Yes, good. So it's time to go now.
Let's go.
Let's
Thank
go.
you. Göteborg Air France 6125, final runway 03. Full flaps.
Full flaps.
Okay.